The Intelligent Hospital, visualizing the future.
Welcome everyone, and thank you for joining. I am very mindful that we stand between you and your lunch. Some of you have already gone, but thank you to those that have stayed. And rest assured, we are going to whet your appetite with a look into the future. And as we look around us here today, so many innovations, so many people doing incredible things. How does it come together? You know, what is that big picture, and what does the future look like when all of these increments come together and give us our healthcare system for the future? And I am really pleased that I've got a real varied panel here to help build that picture. I myself work as a strategic advisor with early to mid-stage startups, helping them figure out commercialization and clinical adoption. I'm also a venture partner with a fund, so I get involved in all sorts of ways. But the panel here has got a wealth of experience. We have some innovators in the panel. We have people that are gateways to different countries in terms of giving access. We have educators. We have practitioners in the actual healthcare systems themselves. So I'm going to hand over momentarily for them to do their own introduction, and would really just urge us as a panel, I guess, to really stick to the topic. You know, this is really about the future. And, you know, we can challenge all sorts of things. Hospital, is that what we will call it? Intelligent, how do we define intelligent? Are we talking just about innovation? Are we talking about workforce? You know, let's kind of really go there in the 30 minutes that we have. So we'll try our best. So with that, I'd like to hand over to the panel for some introductions. And you are already introduced behind you on the board quite extensively. So maybe just a word or two about yourself, and maybe just one word or statement that perhaps gives a hint about how you view the future. If you're visualizing the future of healthcare, you know, one word or statement that perhaps captures that. That's a challenge to get us started. Conrad's nodding profusely there,
Sure.
So I'm going to actually just start with you.
Cool, thank you so much. And we got actually a bit of time added on, so I can waffle. So essentially, you can see all my titles, so don't bore with that. But the key is to be a gatekeeper for quality innovation into the NHS, predominantly and a bit international as well. So in terms of future of healthcare or hospital, the easiest way to frame this is the hospital at home, and how we as patients monitor and manage our health from home better and more empowered.
Thank you, Conrad. Let's go to Jonathan.
Yes, I am an innovator, as you said before. I'm also advising hospitals. I've been working with hospitals for a long time. One of the things that I have seen in hospitals is that where we really need to innovate at this point is, one, making solutions more patient-friendly. There's a really big lack of understanding where we need to start innovating. And I was just having a conversation with a person before. They were telling me we should innovate in ambulance systems and we should innovate this and there. And I was thinking, one of the things that we should do probably first is innovate in the speculum, for instance. You know, I mean, we were still using technologies that were invented in the 17th century. We could probably start there. And then, of course, so that would definitely enhance the quality of healthcare providing that we can give to patients. And then the workflow is super important. We're having a crisis right now with our personnel, so making it better and simpler will work as well.
Thank you. Raj.
Yeah, hi. My name is Raj Mankuti. I'm a consultant surgeon, and I think I'm the clinician here in the panel. I agree with Conrad and Jonathan, and to me, working at different hospitals across in London, and then which was one of the best hospitals rated by CQC, and then working in Sandwell, which is one of the poorest county in England. What I see as an intelligent hospital, we can keep talking about it, but how do we cater to the digital divide? how do we educate the end users, which are the clinicians and the patients, and how do we have strategies to cope up this digital divide in future?
Thank you. Gorgi.
Yeah, hi, I'm Georgi Chaltikan. I'm essentially representing academia. So I teach and research digital health. And being very much focused on education and workforce empowerment, I'd say that a lot in the digital transformation is going to be dependent basically on the workforce and on the cultural change in the workforce. So to me, the future of hospital, and I very much agree with Konrad when he said that's a bold statement. I'm absolutely in line with that the future hospital is the hospital at home. However, we all understand that in the foreseeable future there will be a lot of healthcare, a lot of care processes taking place still in brick and mortar hospitals. And a lot will be dependent on the ability of the workforce to adopt and to embrace the digital transformation. So to me, the future is digital, obviously. We all know it. And I believe that future is coming up faster than we all imagine. But it does require a lot of efforts, including the efforts by us, the educators, to make the people working in the health sector adopt and embrace that transformation.
Thank you. Valentino.
Hello everyone, I'm Valentino Megale, I'm the CEO of Softcare Studios. We are introducing virtual reality in the hospital to replace or minimize the use of drugs like sedatives and painkillers. So we are digitally transform some of the clinical practice occurring in the hospital. So I want to add to the conversation that when it comes for digital transformation, is never something that happens overnight, but it's a process, it's a long process. And the hospital will become intelligent to the extent we are able today to recognize that by introducing these technologies in the hospital, we are introducing new paradigms of experiencing digital content, new paradigms of data collection, but also new paradigms of risk and harms. So digital tech is not only golden opportunities, but it's also challenges. So we are able to tackle and to leverage this potential if we recognize and build a countermeasure to control technologies today.
Thank you. And I guess just with those initial short statements, I think it really paints a great picture, because being here in the midst of a MedTech conference, our mind can easily go to technological innovations, and we think about intelligence in that context, we think about the future in that context. But hospitals of the future, or healthcare of the future, is going to be shaped not just by innovations, it's going to then also be shaped by changing healthcare needs, which we're already seeing and experiencing, and it's going to be shaped by global health challenges, so to your point, Valentino, as well. And these are all of the things that are shaping. And we read lots of articles about, how AI and digitization is changing jobs for the future, and that includes healthcare professionals, right? We're seeing some of that. So I'm really encouraged to also hear workforce being mentioned as you provide your short introductory statements. So let's unpack some of that. And it does make sense to start with innovations, because we are here in the midst of a conference where we're surrounded by amazing innovations. And Konrad, I'd like to come to you first on this, because your role effectively is a gateway to the UK market for innovators. And you get to see a lot, right? You get to see a lot, but then you also get to influence and shape how some of that makes its way into the UK healthcare system. So I'm interested really in your view around how we are shaping one healthcare system out of many. Admittedly, this is just the UK we'll be talking about in your response, but also some of the innovations. Are we starting to see the emergence of more robotic assistants, for example? Are we starting to see 3D printing come in? Are we starting to see smart infrastructure coming in as well? Or is it are we still kind of in the DTX realm, etc.? So over to you on your take for that.
So, I encourage people to jump in and interrupt me, please. So ultimately, and specifically in the UK, the biggest problem we have is waiting lists and workforce shortage. Nobody needs to come to me with a little gimmick that solves a problem for 100 patients. That's just not going to help anybody. We don't have enough beds in the UK. We don't have enough real estate to put patients in. So that's reality. And ultimately, what we can do in this role that I'm heading up as National Director for the NHS Innovation Accelerator is to look at innovations with a real sort of impact picture and a real life picture. Yesterday, there was I spoke about pilotitis, and that's exactly what we're trying to avoid. What's the stuff that can impact system now and help right now, because the house is on fire, and it's not just in the UK, it's everywhere. So when we talk about the future, we actually, in the UK, we're talking about how can we maintain what the NHS is doing right now, how can we maintain that for the next 10, 20, 30 years. We're not talking about how can we lift our hospitals up into space and whatever, it doesn't matter, and quantum computing and just go home. That's not the point. How can we maintain the current standard of care and make that a little bit better? So and that for me is the future of hospital, and not the latest gimmick. And you mentioned workforce, right? I think that's and workflows, sorry, as well. And I think that's the key. We need to get those things right in system.
Thank you, Conrad. And I'm going to be a touch controversial on that point. But the beauty of being the moderator is I then don't have to answer. I'm going to hand over to the rest of the panel to see what they think. So I'm just going to land the bomb and then let others deal with it. So I totally understand that whilst we have a burning platform, it's hard to visualize the future, in the purest sense of doing that. And it's hard to build a system for the future when we've actually got fires to put out. But the challenge, I guess, really is how do we then ensure that the innovations that perhaps might only be relevant for a small cohort of patients that are very niche but can be hugely transformative, potentially in the future, where perhaps another pandemic, another challenge hits us and we suddenly find that small cohort is a massive cohort of people that we suddenly have to help. How do we, and I'll open it up to the whole panel, but how do we strike that right balance when we're trying to visualize the future, we're trying to build this intelligent healthcare system, but we're actually so anchored and grounded in the realities of today that all we want to do is get innovations off the shelf, implemented for here and now.
It's called the power of hindsight.
Sorry?
It's called the power of hindsight, which you don't have, and nor do I.
Open up to the panel. Raj.
I agree with Conrad. There's huge disparity within the NHS, and he would agree it's a postcode lottery wherever you stay. I just want to I had some numbers. There are around 2 million people in UK who don't have internet access, and there are around 10 million of people who lack basic digital skills. Now, I'm telling this because I work in Sandwell. We have around 15 nationalities and over 22 dialects. To me, an intelligent hospital starts from very basic, that we have interpreters. We can speak to them. We can tell them what surgery they want. They're not bothered with whether you're doing a robotic or there's some AI sitting and operating on them. They want to know what's happening. And how do we manage this digital divide? The NHS has announced around 21 million recently for AI, and I think they have a 180 million budget for next 3 years. But we have over 215 trusts and over 1,500 hospitals. So we need strategies how we cater to this. How do we empower not only clinicians who would want to use this digital service, but how do we empower patients to use these digital services?
I know others want to talk as well. I want to get one in with my colleague as well. It's public system UK, America privately run system. They couldn't be more different. So let's not compare apples with pears. I think we need to be really careful, and I agree with you, right? So let's be careful about private versus publicly owned healthcare systems. The NHS is a public good, as we all agree, but we have 196 countries that may not have that.
And we have some of those other healthcare systems represented on the panel. So yeah, let's hear from some of you.
So I've been in the board of advisors of the third biggest private hospital group in Latin America, which moves probably more money than NHS. And what I realized by being in the board of advisors is that every hospital has their own needs. So that's one thing. We can't just say, we're gonna deploy this in every single hospital. It doesn't work like that. We have hospitals that have hyper-specialized radiology departments and hospitals that do loads of different EP procedures that are actually the essential revenue-making point of that hospital. So, and of course, we're talking about different populations that have different needs according to the different hospitals. So, in my opinion, we start innovating in these hospitals by understanding the necessities of the hospital itself, and then taking the first step. Usually that means that we're going to have to identify the biggest populations that will be benefited from this, and it will be done in a sort of like a scaled way, starting from the majority to the minority. That has to happen like that because it's the only way that the hospital could justify expense versus revenue and ROIs. Otherwise, this is not a strategic point for the hospital, and it will actually counteract innovation, which we don't want. So this is how I've been working with different hospitals, and then I got into advising some hospitals in Europe, in the Netherlands specifically, and for them the necessity is completely different. For them, we're talking about mostly is academic institutions that are trying to sort out or solve specific problems in their massive machine. And it's very difficult to make them understand that probably you first need to modernize the machine, right? Before you solve this tiny niche problem. So I've been helping them, for instance, implement artificial intelligence that is intraoperative artificial intelligence for ECG, intraoperative ECG, during ablation procedures. And it's like, yeah, that's amazing. This is a great innovation. But what are you doing this for? And it's like, we would like to predict in the future a patient that could have a recurrence of AF after a procedure. That sounds nice. But on the other hand, you guys have not connected Holters, and you have a team of cardiologists that have to be analyzing the Holters for hours, and you have a long waiting list of patients to get a Holter that they could probably benefit more of an actual already CE-marked AI solution on ECG to assess these Holters, and we could actually decrease that waiting list. So I think it's like, what is a priority for hospitals? That's something that we, physicians that are embedded into innovation, should give us an advice to the institutions.
Thank you. And I want to bring, Georgi and Valentino in before we kind of move this theme on. Georgi, you were about to speak.
Oh, yes. Well, since the panel is about visualizing the future, Ahute and ladies and gentlemen, I'd like us to take a bit of a focus on the challenges that the technology has currently. I mean, I used to say that, well, we're all here not just working in digital health. I'm assuming we're all passionate about digital health. But I do say quite often that what we have now with regard to the technology is pretty much as, comparing a Buick of 1950s to the latest Tesla. So the technology will be evolving. And let's think about the intelligent hospital information systems, for example, health information systems. The technology that doctors and nurses and other health professionals are working with today, oftentimes it's not really solving their problem, but just adding to the problem. Let's think about the burnout. There was a paper that attributes actually an increased burnout of health professionals to the electronic health records. And we know that the technology has a lot of room to improve. And as one of the brilliant visionaries, in digital health, Dr. Topol, he used to say that the technology will really make difference when we get rid of, and he usually shows, and I kind of mimic it or follow it in my classes, when we're able to get rid of keyboard and mouse. So in my understanding, there will be a lot of developments in that technology, and these developments for both the patients and the health professionals will be primarily focused or powered by the change in data input methods. And here I talk voice gesture in place of keyboard mouse, and output technology. And here I talk extended reality.
Yeah.
So when we have that really come in place, that is going to be the time when hospitals are really intelligent, and not only hospitals, but the wider health systems for both health professionals and the patients.
Thank you,
Or
Georgi.
customers. I mean, it's not going to be patient any longer.
Well,
it's going to be all of us.
I love that. We're already challenging terminology in how we're talking as well, so I love that. And a great segue, Valentino, into extended reality and what you're starting to see already.
So, also as a founder, thank you, Jonathan, for bringing the pain of the segmentation of the market, because we are working in more than 20 hospitals in Italy. And there is a quote from the sci-fi writer William Gibson: "The future is already here, but it's not equally distributed." And this is a big problem.
I love that phrase too.
Because when it comes for digital health revolution, the future of this revolution lies in the ecosystem. And an ecosystem means an interconnected and interoperable network of innovations. What we see in the market, in the hospital networks, is that there is very small intercommunication between different hospitals. And this impacts also the work of us as companies working in the medical XR field, because different hospitals have different clinical practice, which is legitimate, which is normal, but they have a different kind of tech adoption. They have a different way of validating tech solutions in the hospital. So this creates a lot of spots of innovation, but they are not so much comparable with each other. And this is a problem. This is a problem locally in the same government, in the same country. And this is the problem when we want to compare the results, the objective results about the impact of these technologies with the global results. Until we are not able to compare and have a benchmark, a common benchmark to evaluate these technologies, this will be challenging for doctors and physicians to evaluate, are we going to implement this technology or not in our hospital? Because they don't have a unified vision. This will be challenging for the patients to understand if they can trust in different kind of solutions, and this will be challenging for companies, for tech providers, to build innovation, because they don't know exactly what is the common terrain where they can build new solutions.
I think that's a really, really important point, particularly as we transition from healthcare systems of the past where there's a lot of legacy. We've talked about the culture change. We've talked about some aspects of workforce where the training has happened in previous methods, old methods, and potentially, dare I say, old thinking as well. And I think that's a really, really important point. Some of us were discussing this just yesterday, that it often feels like, like when you do a jigsaw puzzle, you normally have the picture on the box, and then all the pieces somehow make sense eventually because you know how to build the picture and put the pieces together. And often it feels like what we have are so many important pieces, but we don't have that big picture. And I hear patients often saying that even within, the NHS, they go from one service to another, something they had access to in one service, when they're asked and referred into a different service, they lose access to it. And this is kind of it touches on a little bit what you were saying there, Valentino, as well.
That's the postcode lottery
Yeah.
that my friend was referring to, right? The postcode lottery that you were referring to. Can I just jump in really quickly? I had an interesting conversation yesterday with a colleague here, and Europe and the States make about 700 million patients What about India? What about South America? What about South Asia? That's about 4 billion people. How dare we talking about our experience with our shattered legacy systems when there is a need of a population health for 4 billion people? And I just find it ridiculous. So from an Earth population health standpoint, we should be looking at how can we help this vast amount of people in a basically clean slate healthcare system to handle that properly instead of fiddling in tiny, tiny amounts with our own crumbling one. And it's a philosophical conversation, I know, but we're really forgetting about this huge need, and we're so focused on ourselves in our well-off societies, and that just annoys me.
It's a great segue into where I wanted to take the conversation next, actually, Conrad, and keeping an eye on time as well. I can't believe how quickly the time's gone. I haven't got through half of my questions here, but let's kind of go to the next theme and maybe use this also as a way to start wrapping up the conversation. I guess what you've touched on there, Conrad, my question around that was going to be just to ask the panel for thoughts around, if we're visualizing this future, what are your thoughts on how do we join this up globally? Right? We still enter these conversations. Every panel conversation has been a silo around this country, this market, that market. So what do we do in visualizing the future? The power of technology is connectivity, right? So how do we do this in a way that we join up globally so that there is more equitable distribution of innovation, experience, knowledge? And I'm going to throw in there another point to consider as you address this, which is, what do we do here as things become increasingly digitized and AI-driven? What does the role of a healthcare professional actually become to ensure that we keep that human touch? We're all human. We still need humans, right? So as part of visualizing the future, I'd love to hear every one of you respond to that. So being mindful of time and respectful.
That clock is brutal. It
I
went from yellow to red.
Sorry,
and now it's
guys,
like massive.
just 2 more minutes to wrap this up.
We're going to keep going.
But let's go through and answer that.
Maybe I can just say just a couple of thoughts. One is what Georgi is doing nowadays. I mean, that's really one of the keys, because if there's one thing that is universal, it's education. So if we really want to have a global mindset on this, and we can learn, because we're all physicians, or some of us, we have the same education all over the world, and we follow the same guidelines all over the world. So we understand that education is universal, and that's one of the keys to doing technological implementation. If we want to do it correctly and we want to do it equitably, then we probably want to do it through education. So that's one thing. And then the second thing that I would like to say is, when we are talking about, what Conrad was saying about the world and how can we talk about the entire global market, I think that you're completely right. It's really kind of like a dystopian world where we're living in, when we kind of like disregard a very big percentage of the world. What I could definitely see is that this area where I come from, for instance, it will be also disrupted by technology. It usually follows a path, and usually is a little bit following the steps of the big ones. So if you guys focus on your systems and make it innovative and show the world how that works, then the rest of the world will follow on. That's what I think.
Thank you.
Yeah, I'll quickly go on this. I agree with Jonathan. I think to have an intelligent hospital, we need intelligent employees, and we need digital champion within the hospital, and we also need a digital champion in the community. We need to empower people to be able to use internet service. We should be able to provide internet service, and so that they are happy to use all the services we provide them.
Georgi?
Ahute, you raised just, a couple of questions that we all, I'm sure, could talk for hours or days about.
I'm sure, but 10 seconds.
I'll try to make it in 10 seconds. The future is coming upon us. That future will be there, inevitably, but it depends. It's going to depend on us as just, how smoothly that future will arrive and how, like Valentino said, is going to be distributed. And here I have one key word, just one key word. It's collaboration, collaboration, and collaboration. The world needs thought leaders in order to make the digital transformation smooth, efficient, optimal, and to avoid these tons of challenges that the digital is facing. Tons of challenges. We mentioned here just some of them, including, let's say, the digital divide, inequality, inequity, and so on and so forth. So we do need thought leaders, we need visionaries, and we need global collaboration.
Thank you, Georgi. And very quickly, sorry, organizers, we will wrap this up. Valentino and then Conrad out with a bang.
Yeah, super concise. We are talking about visualizing the future. The hypothetical next panel should be guiding the future. Because if we don't want to become a byproduct of technology and maintaining the technology a tool, we need to guide the future, of course, in an informed way. We should make a lot of informed decisions, and we should remember that the future is a shared responsibility. So everybody can play a key role in shaping not only the potential, but also the challenges of the future. So shared responsibility is my key word.
Thank you. And Conrad.
My bang now.
Yeah.
So I think we need an alien invasion of the planet to make sure we all alien invasion, which means that we're all actually unifying around one cause. The pandemic has shown us that it can work initially, and then everybody zoomed back on their own national needs and got greedy with the vaccines. So I think we just need a big bang for all of us to realize we're all humans, we all have the same diseases, we all carry the same problems everywhere.
Thank you very much. And we will call it a wrap there. Thank you very much. Big round of applause for the panel, please. Thank you.